Patients suffering from most types of low back pain are often referred for physical therapy as an initial conservative treatment option before considering some other aggressive treatments, including back surgery. Next, we meet Monique Serpas, a physical therapist at Touro's Back in Action Center, who explains more.
My name is Monique Serpas. I'm a physical therapist at Touro's Back in Action Center, and I'm orthopedic certified. I treat a variety of orthopedic conditions, including arthritis, back pain, shoulder pain, various orthopedic conditions. Back pain is definitely one of the most common disorders that we treat in physical therapy. And it's a very common condition in the public in general. About 1 in 4 people have had back pain in the past 3 months. So it's very common for people to experience. A variety of people get back pain, from young people to old people. Most of the people that have back pain are in the middle-aged category. They're between 45 to 65 years old. And on the younger scale, we see patients with adolescents with scoliosis. In the middle-aged category, it's more conditions of the joints of the back, arthritis, and disc disorders. There are a lot of risk factors for developing back pain. Some include just being sedentary, obesity, smoking is also a risk factor for back pain. Some of the ones that we work on in physical therapy are inflexibility, stiff hips, poor trunk control, weak muscles, and stiff joints. So kind of go back and forth. Okay, good. So this looks pretty good. And I'm going to just put my hands here, Brandon, and keep doing it. Keep going through the exercise. Yep, one arm, one leg, opposite. And you want to try to keep the curvature in your back stable and steady. And what I like to tell people in treatment is your grandma's fine china, Brandon, is sitting here on your back, and you need to keep it from falling off, so that we can work more on not just the strength of the multifidus, that multifidus group, but we also work on controlling it, because this is not just the strength that can contribute to back pain, but it's also how we use our muscles and the joints. Another one that's more of a stretching exercise is called child's pose. It's more of a, if you've ever taken yoga, it's a common stretch in yoga. So Brandon, I'll have you sit back on your heels, drop your head down, and then we stretch the back into the direction which is called flexion. We're stretching out the larger muscle group here in the back, the erector spinae, and also stretching out the smaller joints of the back, the facet joints. And usually I'll tell people to hold this for about 10 seconds and then to come back up out of it, just like that, and alternate, breathing in, out, come back into the stretch, holding it 10 seconds, to do 5 repetitions of that. Physical therapy is effective for treating back pain, whether it be acute or chronic. Physical therapy has been shown to reduce the medical costs associated with back pain. It reduced overall medical costs in a study they found $2,700. There's reduced injections, need for imaging, and medical visits. So overall, it can help you reduce your costs that way, but it can also help to get you back to work and back to your life faster.